First today at 5, healing from Helene. More than a month after the storm devastated western North Carolina, hundreds of nurses, doctors, and other medical professionals from all around the country are still volunteering at a field hospital in Burnsville in Yancey County. Good afternoon. Happy Halloween. I'm Morgan Francis. Queen City News is closely following the progress being made in that region after the storm. Anchor Robin Kennedy visited the field hospital and joins us now. Robin, how busy are they right now?
Morgan, the field hospital is still going strong. They're seeing 10 to 15 patients a day now, even more than a month after Helene hit. More than a month has passed, and Helene's wrath remains in Yancey County.
Sometimes it feels like a dream. It feels like it hasn't been 32 days.
Amanda Watts doesn't recognize her neighborhood.
The road's gone. The stores are gone. People's homes are gone.
They're all hurting.
But there's so many people that we couldn't get to, and I can't imagine how lonely and scared they were.
Amanda is a nurse and her husband a paramedic. After they made it out of the storm, they started doing what they do best, helping people heal.
We've seen every age group from infants that are 20 days old, I think that was our youngest maybe, all the way up to the people in their 90s.
People had scrapes and bruises coming out of the landslides.
We've done lots of suturing. We've done a lot of wound care.
They've pretty much seen it all.
We've seen heart attacks. We've seen respiratory illness.
They set up an all-volunteer field hospital at the Burnsville Fire Department.
I would say 90% of the people who walk through these doors for treatment are people that I know or people that I love.
Ted Bruner hurt his leg when he slipped on a trailer doing relief work.
My daughter had suggested I come over here. It's a free clinic. It's close by. Said, yeah, why not?
More than 500 patients have visited the field hospital since Helene hit. But when communities are cut off because of the damage, doctors and nurses go to them.
It would be a team of us hacking in and carrying out patients.
Those were the days of rescues right after the hurricane. First responders had to carry out a man who was in his car that flipped down the mountain during a landslide. Now, their work has changed.
They already had a list of patients that they were regularly seeing, but that has grown tremendously since the storm.
When people can't get to the field hospital, teams do house calls.
I try to send a nurse or two nurses and a physician who go out on ATVs to reach people who can't have access to health care.
The goal is to stay here as long as they're needed.
It's heartwarming, but it's also reassuring that we're not in this alone.
Helene had a way of bringing people together.
I think it's been something that will strengthen this community more than anything else could have.
Amanda doesn't think her hometown will ever be the same.
It will never be the town that I grew up in. It will never be the town that I raised my kids in.
In a way, it will be better.
I think we're closer as a county than we've ever been.
Donations for the field hospital have come in from all over the country. Amanda says she has a list of pharmacies and hospitals she can call for help in getting everything from medical equipment to medicines. Morgan.